I couldn't just have an organization without having some institutional credibility. So we went out and created a board of directors and recruited a medical advisory board of people whose names are recognizable and who have very phenomenal resumes, so that we have institutional credibility on the Hill. It isn't just me as a sick patient going up and asking for help. It's academics and researchers who are experts in epidemiology trying to solve the problem. All of these slides, by the way, if anybody wants any more information on any of this, I can give you copies of the slides. There's more information up here on this table you can pick up when the meeting's over. The bills that are listed there, S1350 is the Senate bill, and HR 2505 is the House bill, is the Pulmonary Fibrosis Research Enhancement Act. And I got it from a marketing standpoint, that's not a real sexy title, but it's the best we could come up with on short notice. When we found out, it was Friday when we found out we were going to introduce the bill, and we had to introduce it on Monday, and we didn't have a lot of time to put into it, so that went in. Those are the two pieces of active legislation that are going in the House and the Senate today. There's another slide further ahead about where we are with that, but we have 1/3 of the members of the House of Representatives and 25% of the United States Senators have already signed on to this bill. Same bill in the House and the Senate, with one little tiny difference. How many of you are political junkies? Do I have any political junkies in the room? 1, 2, okay, 3, 4. There's a few. In the last election, the Republicans got control of the House of Representatives. And I'm not here as a Republican or as a Democrat. I'm just here as a strategic advocate for pulmonary fibrosis. But I needed a Republican to introduce the bill in the House. The previous bill had been introduced by a Democrat when the Democrats controlled the House. I went to my own congressman in Minnesota, is Eric Paulson, and said, Eric, you got to introduce this bill. He said, fine, but in the current political environment, in this session of Congress, which lasts for 2 years, we're 2/3 of the way through it, if we ask for new money in the bill, it's dead. You'll never get one co-sponsor for it. Because there's such a political fervor for no new federal spending on anything. So the only difference, if you looked up those two bills and you were excessively compulsive and actually wanted to read them, they're only about 10 pages long. The only difference in the two bills is that there's no financial appropriation in the House bill. That one line just got taken out. The assumption being that if we got the bill passed in the House or the Senate, or the House and the Senate, the conference committee would work out the financial details. So that's where that's sitting. Those are the photographs. Charlie Norwood in the upper right, who passed away in February 2007. Brian Baird and Mike Tassel were our first two champions for this disease on Capitol Hill. The bill was first introduced in 2008, reintroduced in 2009. Now we're up to 2011, last July, about a year ago. The current bills were reintroduced by Eric Paulson and Chris Coons. And the minor digression here, I don't know how many of you are active letter writers or email senders, but the one thing that motivates these guys, those two in particular, is the human side of pulmonary fibrosis, not the scientific side, not the technical side. They get a lot of energy from people who write to them or call them. And if you have the time or the inclination and you were willing to send them a thank you note, thank you for being the champion for pulmonary fibrosis in Congress in 2012, it would mean a lot to them, and I think it would help the cause. It keeps them energized. 3 simple things that this legislation will do. We need a pulmonary fibrosis patient registry, which is the second thing, but it starts by creating a board of experts. Doctors, researchers, people from the National Institutes of Health in Bethesda, Maryland, people from the Centers for Disease Control in Atlanta, people from organizations like Read Matters, patients. It's in the legislation, patient groups. So that they all will sit around the table, they'll be in a conference room for as long as it takes to determine what are the elements that we need to see in a patient registry to make it useful to research. Once the advisory board, they have 12 months to have meetings and determine what the elements of the registry will be. Then they create the registry. The third thing, and all of you know as well as I do, or maybe better than I do, that education and awareness is very low for COPD, for pulmonary fibrosis, maybe not so much low for asthma, but who's working on asthma as an advocacy cause. So this would create a pulmonary fibrosis education and awareness plan and actually fund it. Now we're not talking about advertising the way Macy's does or Coca-Cola does. We're talking about training caregivers and medical personnel. It's quite shocking how few internal medicine doctors know anything about pulmonary fibrosis. And misdiagnosis of the disease causes a lot of confusion in the medical community. So primarily who we're educating with, this third step here, is to educate the medical community, non-pulmonologists who deal with patients every day. Why does the country need those three things? I mean, this is part of the speech that I have to give when I'm up on Capitol Hill. Typically, when you meet with a congressman or senator, you get 3 minutes, 7 minutes, or 15 minutes. So you got to have a 3-minute speech, a 7-minute speech, and a 15-minute speech. They're all very short. So you got to be able to spit this stuff out pretty fast. The National Institutes of Health, in the absence of a patient registry, so we don't have, the honest answer is we don't have any good statistics, but they extrapolate from their databases that there's about 200,000 patients in the United States today. There's no cause, no treatment, no cure. 80% of PF patients are dead within 5 years of diagnosis. The prevalence of the disease is up 150% since 2001. Why is that? I mean, I'm the poster child for that. I just turned 61. The baby boomers are getting older. This disease is diagnosed mainly in people in their 60s and 70s. But I had a conversation just last week with a congressman from Montana. There's a lot of buzz in the Montana media right now. There's 2 young men from Missoula awaiting lung transplants. Actually, one of them got a lung transplant December 1st. They're 17 and 19 years old. Diagnosed with idiopathic pulmonary fibrosis. So sick that both of them need the transplant or they die. So the 17-year-old got the transplant on December 1st. The 19-year-old is still waiting for a donor.
Are they kin? Brothers?
Brothers.
Oh.
So familial?
Familial pulmonary fibrosis, correct. So, you know, while we think of it as primarily a disease of the 60s and 70s, those are the youngest that I've personally heard of. There could be others. But every 13 minutes, we're losing somebody to pulmonary fibrosis. And once again, in the absence of a database, that is an extrapolation that the National Institutes of Health has made from actual registered death certificates. It says, Mr. Fogelberg passed away as a result of complications from pulmonary fibrosis. So you can imagine, and NIH will admit to this, they have to be in meetings. Most death certificates would say that Mr. Fogelberg had a heart attack because his lung, he wasn't getting enough oxygen. His brain told his heart to pump harder and he had a heart attack. And so that's what the death certificate will say. It won't say he died of pulmonary fibrosis. So we believe those numbers are shockingly low. Plenty of motivation for Congress. Everybody in this room, whether you have pulmonary fibrosis or COPD, you've been through all of that. I first thought I was having difficulty breathing, but I thought, man, this getting older is harder work than it sounds like. So I didn't think anything about it. I thought I was getting older and I was out of shape. By the time you get diagnosed, the disease is typically fairly advanced. And most of us probably do all these, the 6-minute walk tests and the bronchial lavage, and you've had all the biopsies and everything else. The fact remains, when I say treatment, that there is no treatment. Steroids, primary number one. There's plenty of nice things to say about prednisone. There's plenty of evil things to say about prednisone. Most of us are on some kind of oxygen therapy, and that makes a quality of difference in your quality of life. And I say it, big rushing for pulmonary rehabilitation, because my first pulmonologist had to retire from the practice. He had a health issue of his own. The second pulmonologist began treating me, said, I'll take you as a patient, but you have to go to pulmonary rehabilitation first. And I said, come on, Tim. I'm 56 years old, and you're going to teach me how to breathe? So this is kind of insulting when I already have a terminal diagnosis. He said, no, trust me, you got to go. And I went, and it was absolutely wonderful. How many of you have been to pulmonary rehabilitation? Almost all. Good for you.
How many still go?
This was a life-altering moment for me. The two women who run the pulmonary rehabilitation program at North Memorial Hospital in Robbinsdale, Minnesota, are absolute angels. And I went through a hardcore twice a week, 16 weeks, before I got my graduation certificate, and it really did change the nature and the quality of my life in a very positive way. So when you find somebody who's short of breath, get them diagnosed, get them into pulmonary rehabilitation. When you do factual investigation, for those of us with pulmonary fibrosis, that guy sitting over there has the best website in the United States. You can talk about the Coalition's website there, and the Foundation, Coalition for Pulmonary Fibrosis, and the Pulmonary Fibrosis Foundation were started in 2000. There was a meeting of a bunch of people in Chicago, because there was no organization for pulmonary fibrosis patients then. They sat around and talked about it for a weekend, and they couldn't agree on how to set up their organizations as one unit, so they set it up as two separate organizations. Political differences, even inside the pulmonary fibrosis community. But when you want answers or resources, help, you know, it's much better than what existed before 2000. But really, Peter's website, IPF Today, is the most knowledgeable website for the layperson, for the patient, from the patient's perspective in the country. There's two of the three, two of the four Fogelberg dogs, Oliver and Cal. I went through all the stages that I assume most of you have probably gone through. Your first is disbelief that it could be happening. You're very sad that it's happening. You get a little bit educated. You accept the fact that you have a diagnosis. And too many pulmonary fibrosis patients, at least that I've met, give up at that point. Say, you know, now I'm about managing the quality of my life until I die. I'm going to get my will done. I'm going to sell all that junk in the garage. But they stop. And I'm just an aggressive consumer. So I said, well, you know, all of those things are true. But in the meantime, while I still can breathe and can still do things, I'm going to take some action.